Our next speaker, President Bill Clinton, needs no introduction at the United Nations. Mr. President, I think you know these chambers just as well as we do. You have graced ECOSOC with your presence in 2005 during your time as Special Envoy on the tsunami recovery, and in 2009 during the Partnership Forum on Global Public Health. You have also rendered service to the United Nations yet again after the devastating earthquake in Haiti, and this was just mentioned by the Deputy Secretary General. Your interest in partnerships as well as public health is well known and no doubt influenced by Dr. Paul Farmer. Your health access initiative has led to concrete results, with millions of people getting access to care and treatment for HIV/AIDS, malaria, and tuberculosis. You have also shown light on the need to go beyond piecemeal action by also highlighting the need to strengthen health systems. With the Clinton Global Initiative, you have redefined the way multi-stakeholder partnerships support development by insisting that commitments must be new, specific, and measurable. As we discuss the role of partnerships in supporting the new development goals, there is no one better to advise us on how to make sure that they deliver results. May I invite you, Mr. President, to address us and also go to the lectern. Thank you.
Thank you very much, President Sajik. Right before you invited me, you probably saw the young man come up and whisper in my ear. He said, "You have to go to the podium." I think when you get older, people believe if you stand up, you'll speak more clearly. I don't know, but I'm delighted to be here. I want to first thank you, Mr. President and Mr. Deputy Secretary General, for your work and for inviting me. I believe this is the 5th time I have appeared before ECOSOC in the last decade for the purposes which the President outlined. I want to thank my close friend and colleague, Dr. Paul Farmer, and Dr. Don from Liberia, Mr. Lama from Guinea, Ms. Rahman from Sierra Leone, who will be on the panel, as well as others I will mention in a moment. You are considering the role of partnerships in developing the successors to the Millennium Development Goals. And you have given those of us who have been involved in some form or fashion in dealing with the Ebola crisis the opportunity to speak about what that means in practical terms. I am very grateful for that. I have been working with Liberia for many years, principally on healthcare, but not entirely, and was there earlier this month, just a few days before the country was declared Ebola-free. As a result of the fact that I was there a few days before, I had to go through all the protocols for daily monitoring of symptoms, and you can all relax because this morning I am officially Ebola-free. Our friends in West Africa have survived a fate that most people could never imagine. They have lost thousands of loved ones. Their robust economic growth rates, built on years of hard work, have been reversed. Communities have been torn apart, not only by disease, but still, sadly, by a lingering stigma against people who survived, because their neighbors and friends had never experienced anything like this before. It's going to take them some time to understand that the people who survived are safe and belong in their homes, belong in their communities, and belong in the future of their countries. They've been forced to shut down schools and other basic services. They've struggled to hold their basic health infrastructure together. It was fragile already before the outbreak, and now it's in worse shape. Not only opening the prospect that future diseases could spread quickly, but also undermining the ability to deal with basic things that are important to not only the Millennium Development Goals, but to the successors, like maternal and child health. The leaders of Liberia, Sierra Leone, and Guinea, the ministers of health you'll hear from in a few moments, the UN, the WHO, all the multilateral organizations who played a response in the Ebola crisis, along with the donor nations, many businesses, many African leaders from government and philanthropy, all stepped up to try to help in the aftermath of Ebola, as well as NGO partners like Partners in Health, Doctors Without Borders, Last Mile Health, and the Clinton Health Access Initiative. They were on the ground during the fight, and many of them put their lives at risk, and no small number lost their lives trying to deal with this epidemic. I am particularly grateful to the governments of Norway, the United Kingdom, and to the Elma Foundation for supporting the work that our Health Access Initiative has been doing in Liberia. It's an example of the kinds of partnerships that we should be fostering in the future. When I was there not long ago, we had a meeting with President Sirleaf, Dr. Don, other Liberian officials, representatives from the multilaterals and NGOs, to talk about how to shift the emergency response to investing in a healthcare system that is well-staffed with thousands more community health workers that will prevent future outbreaks and improve overall health and productivity. I think this work can be done throughout West Africa and indeed across the continent. The message we heard from the Liberians in the meeting was clear. The same I've heard from dozens of other governments and citizens in countries in which our foundation has worked. Help us build the health systems. Help us be more self-reliant, less dependent on aid, better able to provide health care. We can hardly be surprised by the severity of the outbreak when, on the day before the outbreak, Guinea had 1 health worker per 1,600 inhabitants, Liberia 1 for every 3,472, Sierra Leone 1 for every 5,319. How would the health outcomes of each of our countries be if, like Liberia, we had 1 physician for every 71,000 people? That would be the equivalent of having 23 doctors for all of Manhattan. The older I get, the more I'm convinced I use 23 doctors in Manhattan. We're laughing, but it's a very serious matter. For those of us who take our health care for granted, we literally cannot imagine the staggering burden of such severely limited resources. So my basic message is this: more than anything else, though these countries have terrible economic problems, they have to get their schools going again, there are all these things that have to be done. They have to repair the damage that was lost. They have to have health systems, or we'll be back here 4 or 5 years from now dealing with the same sort of problem, if not in these countries, in some other countries. It is the most economically sensible thing to do. Now, each of these countries has generated a 2 or 3 year plan that outlines their needs and priorities. They presented them at the World Bank in April. Liberia requested, I think, $1.3 billion, Sierra Leone, $1.06 billion, Guinea, $2.9 billion. The government of Liberia has also specifically outlined a 7-year plan to strengthen the healthcare workforce at a local cost of $165 million, with $23 million required in the first year, $30 million in the second. Now, if you just run the numbers in your head really quickly, that means if we, the donor community, were to set aside about 15% of any relief over the next 3 to 7 years to strengthening health systems, you wouldn't have to worry about this problem. And I will give you more examples in a moment. But I think it is very, very important. I also know recently that a lot of these countries have been told, well, you know, money's tight and you should give us an 18-month plan. I think that's a mistake. I think that even if the donors don't know exactly where the money's going, Dr. Farmer's office here at the UN tracks the donors. He may be the only person still doing it, but he's bad about that, expecting people to keep their word. And I think it's important not to discourage these 3 countries from presenting multi-year plans. And I think it's important to recognize that within those multi-year plans, they have had the courage to give priority to building their own health system so they can save the lives of their own people. And I will, again, in just a few minutes, I'll try to give more examples of how it would work. First, let me say to the donor nations, if you make these investments, it'll save you a lot of money over the long run. It'll save you the money that you're going to spend on future infectious disease outbreaks, on all the other things that may be superficially unrelated to Ebola, but are in fact correlated with health care, including worker productivity and the ability of children to attend schools. They will help nations to become more self-sufficient, which after all is what all of us want for each of our communities and countries. So I'm hopeful that all the donor governments here present will consider making a pledge in July to strengthen the health systems and the human resources in West Africa. When I was given the opportunity to address this body in 2009, I mentioned that throughout my career in politics, usually only 2 things were debated. What are you going to do and how much money are you going to spend on it? In the world I inhabit now, where resources are always limited, no matter how generous, we spend a lot more time talking about how are you going to do whatever you do to achieve your desired objective. The great contribution that the best NGOs have made to the public interest all over the world in the last few years is the ability not only to stand in the gap between what governments can provide and multinationals can provide and what the private sector can produce, but also to focus on the how question. Not a political question, not a philosophical question, a practical question. I have found that almost always the best way to answer the how question is through partnerships that involve all the major stakeholders. The Deputy Secretary General mentioned a few moments ago that we live in a troubled world. But a lot of good things are happening in this troubled world. They just don't make the headlines because they're not about war and conflict. They're about cooperation and progress. The world no longer worries so much about conflicts between nation states, although to be sure there are still some around. But it's between state actors and not state actors, between people who favor cooperation and those who favor conflict, those who favor inclusion and those who demand exclusion. And one of the reasons that there are so many refugees all over the world is that ordinary people are voting with their feet. They favor cooperation over conflict. They favor inclusion over exclusion. They think violence and theft are way overrated. And they long for the demands of ordinary life where people are rewarded for doing the right things when they get up every day. That is the great struggle of the 21st century world. And so what we know, what ECOSOC was organized to advance in the beginning, is that when people work together across all lines of society and all areas of expertise, they can make good things happen. And we now know that those things will not happen unless there are money, time, materials, knowledge, and skills contributed by governments, businesses, philanthropists, and NGOs. Many hands do lighten the load. And the best projects I have found are often those that have a diverse group of partners who have the explicit purpose of empowering their host nations to one day not need them anymore because they can handle their own affairs. Some of you may know that our foundation, our Health Access Initiative, CHI, has supported a remarkable program undertaken by the Rwandan government to address a critical shortage of healthcare workers in that country. Dr. Farmer and Partners in Health and we worked together to rebuild hospitals in every region of the country. They were all destroyed during the genocide. And then to make sure they were staffed and properly functioning. There's even a cancer center in the Rwandan hospital in Butaro near the Ugandan border, which is the best place in that part of Africa to get cancer care. But the country had no systems. So we came up with a program that now involves, this is an unbelievable story really. It involves 23 partners, including 10 medical schools, 6 nursing schools, 3 dental schools, the Yale School of Health Management, and a number of distinguished hospitals. And they are working to train an entire national workforce over a multi-year period, and they're funded by PEPFAR, and they are only charging 7% overhead total. Nothing like this has ever been seen. I'm pretty sure they're losing money. But they're doing it to make the point that over the long run, the health of the world depends upon people being able to take care of themselves. And in some ways, it's the most exciting project we're involved in now. And that's what Dr. Farmer and Partners in Health are trying to do in Haiti. I hope he showed you a picture of a remarkable health achievement in Haiti recently. But this Rwandan thing, PEPFAR funded it. And then we raised some money from other sources, the Clinton Health Access Commission, and did our part to help put it together. This should be done everywhere. We've done work like this on a less comprehensive basis in Zambia, Kenya, Ethiopia, and several other countries. But when you hear this next panel, and the panelists including, they're out there, Tony Fauci, Jeffrey Wright, and Gary Cohen of Becton Dickinson, talk about the importance of partnership, remember that's what they're talking about. The whole idea is that non-governmental organizations who work with other stakeholders are supposed to figure out how to do things faster, better, at lower cost. And if we do that, then others can come in and scale up the work. It's a work, as I said, driven by impact, not ideology. But because there's no picture that's heartbreaking of someone dying, or no fight, it's easy to not fund it. So I will say again, if you want these kind of partnerships, you got to set aside about 15% of the money that is going to go to these countries to build their health systems. And if you can't fund what they've asked, then it ought to be more than 15%, because what they want and deserve is the ability to stand on their own. You know that intelligence and the willingness to work are evenly distributed throughout the world, and opportunity isn't. You have to empower people to take over this unless you want to deal with future epidemics. This is a general problem, by the way. The same thing is true of hunger and liberating smallholder farmers. I could give you 50 examples, but it's most urgent in this context. So I hope that you will first exalt partnerships, remind people that many hands lighten the load, try to figure out how to bring people together who traditionally have not worked together, and tell people what we're doing so they understand that the modern world is going to be built or brought down by whether we choose inclusive partnerships over exclusive conflicts. Some things that are second nature in the non-governmental world are unfamiliar to others. I know that. But it's immensely rewarding to me to see how totally free of ideology this work is. The Health Access Initiative, for example, received support from center-left governments and center-right governments. And then when the governments change, they keep working with us, but only if they think we're performing. But the purpose is for all of us to be out of the story. We are all trying to work ourselves out of a job. If you look at the progress in health to meet the Millennium Development Goals, and in at least 2 examples exceed them, it's clear that none of it would have happened without a massive infusion of government money, of the international organizations like the Global Fund and PEPFAR and all the others, and big foundations like the Gates Foundation and others. But it's also clear that it wouldn't have happened if it hadn't been for the NGOs on the ground working, building up the capacity of countries to save the lives of mothers and babies and others. We have dramatically reduced the number of people dying of TB and malaria, have the number of people who lack access to clean water, seen an exponential scale up of people receiving antiretrovirals. When I started this work, there were only 200,000 people in developing countries getting ARVs. Today, there are more than 14 million. Just under 10 million are getting them at very low cost on contracts negotiated by our Health Access Initiative. But we don't touch the money. The money goes from the donors to the governments to build the capacity of the local governments to do proper purchasing, proper monitoring, proper distribution. Those are the kinds of things that we need to be reinforcing in the aftermath of the Ebola crisis. It's not enough to get to 0. We've got to stay at 0 cases of Ebola. That will require long-term investments and broad-based partnerships and the willingness to set aside a clear, definite amount to building the systems of the countries affected. And if you do it, you can take these 3 countries plus what's happening in Rwanda and do it in every other developing country in the world that needs the same thing. It's the one clear way we can all work ourselves out of this healthcare job. There will always be natural disasters we'll have to deal with. But in a fundamental way, this was a man-made disaster. If you look at what happened in Nigeria, where with one case they visited 19,000 homes in 5 weeks because they had a system in place when Ebola reared its head. A lot of Americans were infected, none of them died, who got to America because we had the capacity to do this. We did lose 2 people from other countries who came here and they were too sick by the time they got here for us to bring them back. But the things we take for granted, which are not present elsewhere, are the things that I believe we should focus our partnerships on. So, yes, we believe in partnerships. Yes, we believe in sustainable development goals that can only be reached through broad-based partnerships. There is no better place to prove the point than in the Ebola-affected countries. No better way to spend the money than to give them the capacity they need to make sure this never happens again. And ultimately, not to need any kind of assistance from outside except in the case of unavoidable natural disasters. Thank you very much.
Thank you, President Clinton, for your truly inspiring and thought-provoking remarks. Thank you for having found the time to be with us here.